Osteochondritis dissecans is a fairly uncommon condition, usually of the knee, but sometimes of the elbow. It mainly affects children and teenagers, but you sometimes see it in adults. In this video, I'll discuss what it is, the common signs and symptoms, and when it requires surgery. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. So we're mostly going to talk about it with respect to your knee, but just know this is a condition that can occasionally affect, especially younger kids, young pitchers in the elbow. But we're going to talk about it mainly in the knee, as that's mostly where you typically see it. When you hear osteochondritis dissecans, osteochondral, bone and cartilage, what happens is you get, and it's typically on the inside, the medial side, the side closest to the midline of your body, but you get an area, it can be smaller, it can be fairly big, where the bone and cartilage can separate from the rest of the joint. Typically it starts, especially in kids that are done growing, where the bone separates or the bone under that cartilage starts to die for a variety of reasons. And there's a lot of theories as to why this condition happens. Is it trauma? Is it a vascular condition? Something like that. But the bone starts to die, but the cartilage over it is still intact. And if you can get to these kids, and again, this is typically kids that have not gone fully through puberty yet, they haven't finished growing, their growth plates are still open. If you just make them non-weight bearing for 4 or 6 weeks, that bone can sort of regenerate and they do fine. Once that growth plate has closed, then it's probably not likely to heal, and that piece of bone and cartilage can break off. And then has to be basically fixed surgically, put back in place and held with screws or some type of device that holds it in place. Or, especially if it displaces and is outside of the knee, that usually isn't likely to work. And you have to replace that cylinder of bone and cartilage, either with multiple small cylinders of bone and cartilage from another part of your knee or the child's knee, or from a donor, what's called an allograft. The symptoms of this typically, again, in the kids that aren't done growing, where the cartilage is still intact but that bone is starting to die, is sort of a swelling, may or may not have pain, maybe a sort of a dull, achy discomfort, but it's more of a swelling without a specific trauma, without specific symptoms other than swelling. Once that piece starts to break free, things like clicking, things like popping, things like catching, where that piece is loose and it's catching on other structures in the knee, signifies a bigger problem. Occasionally, you will see people that didn't have any issues with, or at least they don't remember any issues when they were kids, even though the problem started before they were done growing. But now they hit teenage years or even early adult, where that piece has now broken free and their knee locks in a certain position, or they have significant pain and swelling because, again, that piece of bone is broken off. And those almost always need surgery to replace that cylinder of bone and cartilage. Again, usually the times that this doesn't need surgery are in kids that are still growing. And even in those, a period of non-surgical treatment, if it doesn't work, then a lot of times there's going to be some type of surgical procedure to try to keep or try to help that lesion heal. It's a difficult problem. Fortunately, it's not terribly common. You see it a little bit more in boys than in girls, but it can be a very, very tricky problem, especially in young athletes. Now, I'd love to hear your experience with your knee injury. Leave those in the comments below. Just understand, I can't offer you specific medical advice, but I will try to discuss your topic in a future video. Make sure to subscribe to my channel, click the bell to be notified when I release a new video and when I start my next live stream, including my Ask Dr. Geier live shows. If you yourself have knee, hip, shoulder, or some other joint pain, and you want to get significantly better in the next 30 days without cortisone shots or surgery, learn more about working with me in the description below. Thanks so much for watching. I look forward to helping you feel, look, and perform better than ever.